Hi friends, and welcome back to this channel. Today I'm going to be talking about something that's near and dear to my heart, which is teaching. For those of you who don't know me, I'm a hospital pharmacist with over 10 years of practice experience in the hospital setting with a focus in cardiology. I've also been fortunate to be the recipient of several teaching awards over the years, so I kind of feel like I am qualified to talk about this. But here's the real reason why I do what I do. I too, believe it or not, was a struggling resident. It took several devoted preceptors who invested their time and energy into me to help me pull myself out of a rut. So putting together videos like these and teaching to the extent that I do at work are my ways of paying it forward. My philosophy for teaching is very simple. I train residents to not only be competent, but those who are critical thinkers, are proactive, and those who truly own their own decisions. Not just for the duration of their 1 month rotation with me, but for the rest of their careers. The first pillar is about obtaining accurate information about your patient. Not just reading through the chart, but if there's something that doesn't quite make sense, also confirm with the patient and do your own independent assessment. One of the exercises that I get them to do when they present the patients to me is that I like to make sure that they can tell the patient's journey from when they start to feel unwell all the way until you see them in almost like a story, and that they should be able to tell it every step of the way, and the decisions that were made in terms of what therapies that they received in the emergency department, what types of testing that was done. And people will ask, like, why am I doing this? Because frankly, despite algorithms, protocols, and everything, people and things still fall through the cracks. Tests that should be ordered are not ordered, or transcription errors, communication breakdowns, language barriers. There's a bunch of things. When time comes when the resident is supposed to assess the patient, I get them to really review that and it makes sense. I put a huge time crunch, especially towards the end of their rotation with me. A couple of reasons for this, one of which is they have an oral exam that they need to do within 2 hours at some point during their program. More secondly, it helps them to prioritize what they need to do for the day. And it sort of gets them and gears them ready to start practicing as an independent pharmacist by the time they finish the residency program, rather than babying them all the way until the very end and then having them crash and burn when they start to come out and practice by themselves. So when I assign patients towards the end of the rotation, I usually will try to give them only about an hour and a half and really have them focus on prioritization and efficiency. Because at that point, most of the time, I know that their thought process is already in place. And so that's no longer an issue. They just need to stop wasting time on things that don't really matter. This then ties into critical appraisal. I always get them to ask themselves, does this make sense every step of the way? In addition to that, I always ask them, what are the implications of what you decide on? What is this going to look like a couple days from now? What is this likely to look like a couple weeks from now? And I also train them to have a backup of a backup of a backup. So in terms of recommendations to a doctor for a patient's medication regimen, I train them to not only have a plan B, but a plan C and a plan D, if they can. A strong clinician isn't just right once. They have a contingency for every turn. If plan A gets shot down, instantly give them plan B, and a good rationale for that. This shows mastery and anticipation. Bridging the gap between textbook knowledge and the patient, which requires expert communication, especially with doctors and nurses. First, I have the residents connect what you know about the literature with that patient, whether it's extrapolating from systematic reviews all the way to honing down to what the primary literature says or what the trials did include, as well as any peripheral observational data that comes out that suggests what were actually done to patients of this sort. This gives the resident more of a holistic view of what the body of literature actually says about that particular patient that you're trying to apply literature to. And then we also focus on interprofessional communication. When you're talking to a busy team, your questions and recommendations need to be clear and concise. Tip number 1, phrasing for maximal impact. So rather than saying, do you think we should hold the Ramipril because the blood pressure is kind of low? Rather, I try to get them to be more assertive. Given that the patient is dizzy and lightheaded with a blood pressure of 90 on 60, I think we should hold the Ramipril for a day or so just to see how he does. Tip number 2, use your voice to your advantage. Your voice and your intonation needs to reflect your level of confidence. Speak with authority. Slow down slightly with a firm tone and make sure you don't use an upwards inflection towards the end of your sentence. Make it a statement, not a question. So this will align the visual, auditory, and vocal confidence to reinforce the reliability of your recommendation. Counseling a patient isn't just about feeding them information. They get a ton of information from the hospital already, and most of the time they are overwhelmed as shit and tired of listening to all these things. It's about assessing their understanding of their medical conditions and the medications that go along with it, and giving them the core things that they need to focus and monitor for. I always demonstrate to the residents first of how I engage with my patients. Your patient probably doesn't want a super uptight person looking after them and feeding them information robotically. I show my residents how I connect with my patients while being professional. A warm and engaging, clear message to the patients helps build trust as well as make the information stick better. We need to create an environment where we present the core critical things, what dangerous side effects to watch out for, how to manage these things, and what to do in those situations without overwhelming them. At the end, I usually will try to do a teach back where I assess their retention and understanding of the information that we had just gone over. Because if they can't explain it back to me, I haven't done my job. The final components are designed to build intuition and clinical acumen. So whenever there are procedures done on the unit, whether it's a cardioversion, a pericardial tap, meaning they're literally sticking a needle into the patient, they are doing an echocardiogram, like a heart ultrasound, I will try to get time for the residents to visually observe some of these things. Watching a live procedure and seeing what the patients actually have to go through in real time, and the complexity and all the intricacies of all the things, like what kind of drugs are given for sedation, what local anesthetics are given when they need to go and poke a hole into a patient to get the fluid around their heart. This is all crucial, I think. It gives residents a profound understanding and the gravity of the situation and the decisions that they make. Physical examinations. Now, I have a video about this by itself. If you're interested, feel free to find it somewhere on my channel. I will try to include it in my description. But I believe pharmacists need to develop this skill. For you to make an independent assessment and decisions on drug therapy, you owe it to the patient to understand what you're really up against. This skill, sharpened over time, will strengthen your clinical acumen like nothing else. Trust me. During their month with me, I also try to evaluate how the resident facilitates discussion and genuinely interact with a group of people. They learn how to actually communicate, because I strongly feel that this not only helps create discussion and trigger critical thinking in the entire group, but also helps to build real-world interdisciplinary communication skills. Finally, I try to model resource management and commitment to lifelong learning. I spend my mornings, early mornings, reading and analyzing literature, mostly because I don't have the time at work to do so. Even 15 years out from school, I still try to keep up with literature as well as review any old studies. I am a self-proclaimed nerd, and I am proud of it because it helps me to make better decisions for my patients. It helps me come across as more competent to my team and also maintain that trust. This isn't just a job for me. I see it as a life purpose. And I hope to instill that same level of passion and commitment to the residents that I teach. So what's one thing that you learned in your training that made a huge difference? Let me know in the comments below. If you found this video useful, hit the like button, subscribe, hit the notification bell for more deep dives into clinical pharmacy. Thank you all for watching, and we'll see you in the next one. Say no to drugs.